In healthcare, work fails between systems. MCP is the first thing in decades that takes that problem seriously. MCP stands for Model Context Protocol. It's an open source standard introduced by Anthropic in 2024 that allows AI models to securely connect with external data sources, applications, and tools. Think of it as a USB-C port for AI, enabling LLMs to interact with databases, files, and APIs in a standardized way rather than relying on custom one-off integrations. Luma users can now access data via MCP. We'll talk about that more later, but let's start with an example. A patient is referred in. The referral sits in System A. The auth is in System B. The schedule is in System C. The intake is in System D. And the clinical note lands in System E. Every scene between those systems is a place where work gets dropped, a patient gets lost, or a staff member has to manually patch things together. Health systems have spent decades buying and building tools to fix those individual systems. MCPs let, in one place, Luma in our case, read from and act on all those systems with the right permissions and in real time. In other words, MCPs get rid of the seams in healthcare. This isn't integration in the old sense, like syncing data overnight and hoping it's fresh, HL7 feeds. This is acting across systems in the moment the operator needs it. For 20 years, the answer we've had is, we need these systems to talk and build a custom integration or buy a data warehouse. Both could take months and are still out of the box. MCP is the first standard that makes cross-system action feasible at the scale that healthcare actually moves. That's why Salesforce announced headless. That's why every major SaaS vendor is moving towards it. What this means for Luma customers specifically, you already have Luma in your EHR. You already have Luma touching 700 million plus data points with patients. MCP is the bridge that connects what we already do with everything else in your stack. The next 2 episodes will show what that looks like in practice for both patient access and for IT.